NCLEX is not testing how much you know. NCLEX is testing how fast and how well you can think under pressure. And every question is usually built with a trap, a subtle distraction designed to make you hesitate. And in this series, we're going to be breaking down exact traps that NCLEX sets, the ones that cause high-performing students to miss questions that you usually understand. Because if you can spot the trap, you can beat the question. So let's get into the trap for today. The pain out of proportion trap. We observe this out of studying question banks when a client has a pain that you cannot quite identify. NCLEX is trying to trap you. How do we mean? Now, NCLEX is a safety exam. It does not reward superficial assessments. It rewards your ability to recognize early catastrophe. And one of the most dangerous and most frequently tested clinical cues is where there is severe pain that does not match physical findings. In your STEM or scenario, you might find phrases like the pain is much worse than expected, the client reports 10/10 pain, minimal visible changes, or the pain suddenly worsened, or there is burning pain with mild erythema, or the pain is not relieved by opioids. When NCLEX inserts any of this cue, it's really about comfort management. We're likely talking about tissue deaths. So this is testing your ability to recognize deep tissue ischemia before it becomes obvious. Now, most students might just see redness, mouth swelling, stable vital signs, and you think, oh, local wound care. But what NCLEX has in mind for you to identify is a rapidly progressing soft tissue necrosis. And the classic diagnosis behind this pattern is necrotizing fasciitis, but the principle applies broadly because it can signal compartment syndrome, acute mesenteric ischemia, testicular torsion, internal hemorrhage, early sepsis. And the exam is not trying to test what dressing you should apply. It's trying to test whether or not you'll be able to recognize this before the tissue dies. In most cases, the skin in the scenario might look mild, and so candidates might not be able to spot out the trap because humans see what they see. But NCLEX is testing beyond what you can see. The danger could be under the surface. Talk about tissue hypoxia, rapid bacterial toxin spread, and etc. So the external wound lags behind internal destruction. Okay, while the wound appears manageable, the pain signals catastrophe. You could also see distractors such as in the options, like they're suggesting to apply an abdominal binder or initiate negative pressure wound therapy or reinforced dressing. All of these are reasonable interventions, but they are not the most urgent intervention. Remember, the key is what is the most life-threatening process happening right now. That's what NCLEX wants you to think in 2026 and beyond. And if the infection is invading facial layers, the only answer is broad-spectrum IV antibiotics, immediate surgical evaluation, aggressive source control. Anything else that you try to do delays survival. So remember, for emphasis, pain out of proportion typically signals a threat to circulation, tissue perfusion, systemic stability, and all of this clearly outrank comfort, education, routine wound management. So if you read a question and they mention any such thing as disproportionate pain, rapidly worsening pain, severe pain with minimal findings, pain that is unrelieved by medication, you need to ask yourself, is this deeper than it looks? If yes, you need to escalate your thinking. Ignore the appearance of the wound, focus on the pain pattern. Scan for systemic cues like fever, tachycardia, hyperglycemia, and then choose the intervention that will stop tissue destruction. If surgery is an option, consider it seriously. If IV antibiotics are listed, prioritize them. If the question feels dramatic, it probably is. And if you're unsure, you need to ask yourself, what option prevents death the fastest? Is it dressing change? Is it pain medication? Is it spiritual support, surgical evaluation? Yes. IV antibiotics? Yes. So you need to choose the answer that interrupts the lethal process. Just for emphasis, if the pain is worse than the wound, you need to think deeper than the skin. Severe pain out of proportion is never a comfort problem. It's usually a survival problem. So if you found this helpful, imagine learning every system this way, organized by question bank patterns and not just textbook chapters. At VPNG NCLEX Academy, we don't just review content. We train you to recognize traps, prioritize like NCLEX, and think in safety hierarchies. If you're serious about passing NCLEX and passing the first time, visit our website vpngglobal.com and get enrolled. Subscribe to this channel and turn on post notifications. See you at the next NCLEX tip.